How to manage fever after surgery. If you have just had surgery and are wondering how to handle a fever, you are not alone. Many patients experience a mild fever in the first couple of days after their procedure. This is often a normal part of the healing process. However, it is essential to know how to manage it properly. First, keep an eye on your temperature and any other symptoms. Regularly check your temperature. If it goes above 101 degrees Fahrenheit or 30.3 degrees Celsius, or if it lasts longer than 48 hours, you should reach out to your healthcare provider. Also, be alert for signs of infection. Look for increased redness or swelling at the surgical site, warmth, drainage, or any unusual smells. If you notice worsening pain, difficulty breathing, or sudden weakness, seek medical help right away. Next, consider using medications to help reduce your fever. Acetaminophen, commonly known as Tylenol, is often the first choice for managing fever and discomfort. You can take it every 6 hours as directed by your healthcare provider. If acetaminophen does not work for you, non-steroidal anti-inflammatory drugs, such as ibuprofen or ketorolac, may be alternatives. Always consult your doctor before using these medications. It is important to note that you do not need to take fever-reducing medications unless the fever is uncomfortable or very high. Following your postoperative care instructions is also vital. Keep your surgical site clean and dry, as instructed by your healthcare team. Good hand hygiene is essential, especially before touching your incision or changing dressings. If your doctor recommends using an incentive spirometer, be sure to do so. This device helps expand your lungs and can prevent respiratory issues that might lead to fever. Staying hydrated and eating a balanced diet will also support your recovery. If your fever persists beyond the first 48 hours or is accompanied by concerning symptoms, it is time to seek medical evaluation. Your doctor may order tests like blood tests, urine tests, or chest X-rays to determine the cause of the fever. Treatment will depend on what is found, which may include antibiotics for infections or other necessary interventions. Avoid activities that could complicate your recovery. Heavy lifting or strenuous exercise should be avoided until your healthcare provider gives you the green light. Smoking can also hinder your healing process and increase the risk of complications, so it is best to stay away from it. Lastly, keep the lines of communication open with your healthcare team. Report any new or worsening symptoms as soon as they arise. Follow all discharge instructions and make sure to attend any scheduled follow-up appointments. Managing a fever after surgery involves careful monitoring, using medications appropriately, and following your healthcare provider's instructions. While fever can be a normal part of recovery, it is essential to stay vigilant and take action if needed.